glad to be here at the Genesis Center with my colleague, Associate Minister of Health, Brandy Penn, to announce new healthcare supports for Calgary's South Asian community. As a popular gathering place, a community hub, the Genesis Center is one of Northeast Calgary's gyms and a perfect space to make this announcement. And thank you very much to the Genesis Center team for hosting us here this morning. We are also grateful for the work Punjabi Community Health Services Calgary is doing in serving the health and social needs of the city's South Asian community. Joining us to speak on behalf of PCHS Calgary this morning is Board Chair, Ms. Ravina. She is also joined by Program Supervisor and Psychologist Rupinder here and Dr. Japinder Bains. And we also have with us this morning Atya Ashna, a member of the Minister's Opiate Emergency Response Commission. Atya brings a strong voice to the Commission with her background in the community collaboration and history of working with a range of diverse organizations around the city. I will now call upon Ms. Minister Penn to make this morning's announcement. Thank you.
Good morning, and thank you for joining us for today's event. I'd like to begin by acknowledging that we are gathered here today on the land of the signatories of Treaty 7. I'm pleased to be here with so many people from the local community here in Northeast Calgary and with strong supporters of Punjabi Community Health Services. Together, we are committed to doing everything we can to help reduce the toll of the opioid crisis on Alberta communities and families. We've been working closely with our partners, community organizations, treatment facilities, healthcare providers, municipal leaders, to reduce the devastating impact of the opioid crisis on Albertans. The key is making sure supports, services, and treatment are in place for everyone who needs them, as close to their homes and families as possible. And that's where Punjabi Community Health Services comes in. With its mission to support and promote happy, healthy, and successful families, PCHS is a well-established community health partner here in Northeast Calgary. This organization, led by Ravina and her team, is one of the first places families and individuals reach out to for mental health and substance use supports. It runs a support and counseling group for men struggling with substance use. The program has helped more than 400 men. PCHS is seeing an increase in the number of people seeking help for opioid use and has stepped up to support them. To help PCHS respond to the needs of families and individuals looking for life-saving overdose prevention and treatment options, I'm pleased to announce a $560,000 grant to the organization. This grant is in response to a recommendation put forward by the Minister's Opioid Emergency Response Commission. The individuals on the Commission bring unique backgrounds and a range of perspectives to the table, which is important given the impact of the opioid crisis on diverse communities across Alberta. I wish to thank Commission member Atya Ashna, Community Collaboration Specialist on the Commission, for her work looking at how our actions must be culturally sensitive to the unique needs of the families and individuals affected by substance use. Punjabi Community Health Services provides an important bridge between South Asian citizens and the harm reduction and substance use treatment services offered through Alberta's health system. Almost 27,000 people in Calgary speak Punjabi at home, and another 10,000 speak Urdu at home. For those whose first language is English, it can be challenging to speak with our doctors candidly about how much alcohol we drink, or if we have other concerns about opioid use or other substances. And this would be much more challenging if English isn't your first language, or if you don't speak English at all. Opioid use can impact everyone, people of all backgrounds, income levels, and communities. And this grant will help PCHS to give out naloxone kits to people at risk of experiencing an overdose or of witnessing an opioid overdose. The agency will hire 2 new case managers who are registered social workers or provisional psychologists who can also speak Punjabi, Urdu, Hindi, Nepalese, or a combination of South Asian languages. These managers will provide counseling and act as health navigators, linking people with treatment programs such as Suboxone or Methadone treatment. This is the type of treatment that's recognized by the medical community as the gold standard in helping people recover from opioid dependency. Using a harm reduction approach, the case managers will also run workshops to raise awareness about how to respond to drug use and to open up the conversation around substance use to help address stigma. Harm reduction tools recognize that an individual will continue to use drugs and put themselves at risk in the absence of harm reduction supports, like naloxone kits and supervised consumption services. Punjabi Community Health Services will set up a peer mentorship program where people with lived experience will meet with individuals and families affected by substance use. Another support group will be created to help those on the road to recovery.
Thank you.